Welcome to Leveraging the Laboratory, a Mayo Clinic Laboratories podcast for administrators, outreach managers, and laboratory professionals to learn how best to leverage and optimize the laboratory for patients, clients, and staff. I'm your host, Jane Hermansen, Outreach Manager for Mayo Clinic Laboratories. Joining me today, I'm super excited. Karen Kloke is our Director of Scientific and Technical Publications for Mayo Clinic Laboratories. When it comes to assembling, editing, vetting, and publishing laboratory test information, Karen is our expert. And when we think about test information from the viewpoint of a lab outreach customer, we realize that they can't order a test unless they know what to order and what type of specimen to collect. They might need to order a screening test, a confirmatory test, or a really specific test to answer a very specific clinical question. And how do they know what to do and how to order it? So once they have a test result, then the next piece is, how do they know what that result means? Well, they're likely going to look it up where? In a test catalog or some kind of directory, whether it's electronic, hard copy, or something else within their own EHR. So Karen, I'm hoping today we can actually discuss some tips that are related to optimizing labs information about testing and assembling it in a fashion that it's friendly for the user. Sound good?
Definitely.
So,
Looking forward to the
okay, so why
conversation.
don't we start first, Karen? Tell us a little about yourself and your role at Mayo Clinic.
Well, I have been in the healthcare field for many years, actually. I started as a file clerk in a physician's office when I was a teenager. So from there, I went to college. I got my chemistry degree and I went back and then I got a degree in medical technology. I worked for a couple different hospital systems before coming to Mayo in 1999 as a tech in the laboratory. So I worked as a laboratory technologist here. I also worked as an assistant supervisor and a technical specialist in our laboratories and transitioned to my current position about 6 years ago. As director of scientific and technical publications, I partner with the laboratories here at Mayo Clinic, as well as our regulatory groups, who ensure that our test catalog information is accurate and standardized in terms of formatting, verbiage, content, presentation, the type of information we want to convey to our clients so they are able to send specimens to us correctly the first time, every time. My team is also responsible for our joint test catalogs, which are utilized by our MCL clients, and we provide demonstrations, training, and support in regards to those catalogs. We also create collection instructions, test request form, testing algorithms, a lot of things that are utilized by healthcare professionals to find out what testing is out there, as well as help our patients and our clients' patients collect the specimens correctly the first time.
So I think you're well equipped for this conversation. I'm just going to guess. It sounds pretty good. So, Karen, you've been in the industry for a while, right? So
I
across your
have.
career, have you seen providers and how have you seen providers and healthcare professionals access laboratory test information?
Well, I can tell you, I used to get phone calls about our hard copy catalogs quite a bit because that was considered the Bible. If a provider needed a test and they couldn't find it in that hard copy catalog, they wanted to know where can they find the test to be performed. If it's not performed in-house at their own lab, where could they send it? While I was working in a different laboratory, different hospital system back in the 90s, we relied heavily on those hard copy catalogs to get the test information. And our LIS system had the specimen information in it for the test in-house. But when you get a physician that's calling and says, hey, I want test XYZ that's performed somewhere else, you were going to that catalog and getting, sometimes little paper cuts on your fingers going through all the catalog to try and find that test for that physician. And then you would order it in the system as that specimen to collect, and then write out a paper requisition to send it on. So providers are relying on those hard copy catalogs. The laboratories are relying on those hard copy catalogs. And as the years have progressed and technology has grown, So did interfaces to the outside laboratories. So more and more of those outside tests were contained within the LIS, made it easier for the physicians to order, and made it easier for the laboratories to collect the specimens. And then websites came up and were created and contained additional test information. So now, instead of having the hard copy catalog, you could type in a test name at your fingertips and it would bring up the information for you. In fact, here at MCL, we stopped printing the hard copy paper catalogs in 2013. The test menu had expanded to the point where it wasn't easily contained in a paper catalog anymore. It had gotten to the point where it was 2 5-inch ring binders of test information. It is more easily accessible on the websites now where you can type in a test name and search for it. So that's how it's kind of evolved over time. Even EHRs are, the electronic health records. You are able to access test information within the EHRs. So results are streaming back into the EHR rather than going through paper records and charts, like I did when I was a teenager, and adding those paper results into the patient charts. You don't need to do that anymore. So there's a lot of progression and a lot of progress throughout the years to electronic.
Oh, absolutely. And it's funny though, because people really still liked those hard copy pieces of paper.
Definitely.
And I just looked over at my bookshelf as you were talking, and I have a copy of an old test catalog from long before I was in the industry. I was probably in elementary school, and it's about 7 inches tall and 5 inches wide. That's how big the catalog was at that time.
Mhm.
So we've come a long way, baby, I guess, right?
We certainly have. We
So, in
certainly
your
have.
opinion, Karen, when you think about a lab outreach program, how important is it for a lab outreach program to have a lab test catalog?
Oh, it is vitally important to have a lab test catalog in some way, shape, or form. It's more than just a list of tests. It's your daily connection to those providers. So it provides crucial information to the ordering provider, helping them to ensure that correct test is ordered and performed, as well as providing collection information, handling of the specimen, shipping information that helps to limit test cancellations and recollections due to an initial incorrect specimen submission. It also contains special information about the test. Some of the tests, you need to protect that specimen from light, otherwise it's going to degrade. So that information can be conveyed. It can contain links to any forms that you may have or collection instructions and other resources that could assist the ordering provider. It can help reduce the need for the provider to call the lab with questions. If you have that information out there and you find that you have been getting more phone calls from your ordering physicians, you can add that information to the catalog to reduce those numbers of calls. It also can help with utilization of tests, like ordering guidance. Maybe the test that they're ordering isn't the right one for that time, and there's a better test for them to order. You can add that information into the catalog. Also, it provides the ordering physicians with the types of testing that are available. There are so many new tests out there in the marketplace right now. I believe the tests are starting to creep into a lot of the hospital systems as well as the reference labs. They're learning about these tests. And if they're in their catalog, they can go, oh, I remember reading about that. Great, this institution is doing that. I can start sending testing to them about it. It's a way for them to have the knowledge at their fingertips. And without having that catalog, then how are they going to know? The other positive thing about having a test catalog is it's a great way to advertise your outreach program, especially if it's a web catalog. It provides a digital presence in the marketplace. Even if it's not digital, a test catalog gets your institution's name out to providers and allows them to see what testing you're providing.
Absolutely. Well, that's a lot of stuff. So clearly, we've
So,
seen a transition and a lot of things that should be included. It's super important, primarily to just support the clinical activities related to ordering the tests and making sure you're submitting the right specimen. So when you think about putting together a test catalog, and I just think back to even what it looks like for the SOP in the laboratory, right? We might have an SOP that is 10 pages long, very detailed, very complex related to the science. Now, if we were going to convey the information that we thought was most important to a customer to order a test, we wouldn't give them the SOP, right? So when
definitely
you
not.
think about what should be included, there might be some basics, right? There might be some nice to have, but not critical. And then there's kind of this moonshot, put it all in there that's important. How would you scale those types of categories of information? Basic, really helpful, but maybe not critical, but helpful. And then let's just go for it all. What do you think?
Well, basic necessities. You need to know what test you're ordering, right? So you need to know the order number or the test ID, however you want to have that test ordered in your system. The other thing you need is a test name. What I will say about test names and to be cautious of is to don't just use an abbreviation in the test name because some abbreviations have multiple medical meanings. And you want to make sure that the physician clearly understands what the test is for. That I'm
Sure. So
putting
like
that out there.
POC being point of care or products of
Products
conception,
of
right?
conception,
Right.
100%.
So huge,
Mhm,
huge difference in those two. Just that's one example that comes to mind real quickly.
definitely. Um, Specimen collection criteria. You need to know what specimen is needed for the test. If you just say urine, is there a preservative needed? Is it a 24-hour collection? Is it a random collection? You need to provide that type of specimen information. So specimen type, if there's any patient preparation needed, does the patient need to be fasting and for how long? Do they need to abstain from any medications before the testing is done? Biotin is one of those things that has been creeping up for a lot of the chemistry analyzer tests because it is an interference with the test method. So a lot of the tests, you may say the patient should abstain from biotin supplements. You need to know what anticoagulant or preservative is needed, depending on the specimen type, the collection container, possibly a submission container, the volume needed, rejection criteria. What is going to result in a rejection? Is there hemolysis, lipemia, icterus? Is it a turbid urine specimen? Whatever that rejection happens to be. We already kind of mentioned light protection before. That comes into play as well. If something needs to be protected from light, put that in your catalog. And specimen stability. How stable is the specimen? You don't want it sitting on the counter at ambient temperature for 24 hours or being shipped at ambient temperature when it really needs to be refrigerated. Reference
So
ranges can also be added, but they're a good thing to have. I wouldn't say they're necessarily a must have, but they're a good thing to add. And you were going to ask me a question. I'm
yeah,
sorry.
yeah. So I was just kind of thinking along the lines of it kind of falls into several buckets, right? Because you just even went to the next piece. So first piece is what do I need in order to submit the test? Specimen
Yes,
requirements, rejection criteria. If you have a hemolyzed specimen, don't even bother to send it because it's going to be rejected. That's one thing.
exactly.
And then you're
Hmm.
now talking about getting into reference ranges and that kind of thing. So now it's almost more clinical. So it's kind of this pre-analytic and now it's attached to the analysis. So I think you're kind of following just the whole testing process. So keep going. I like it so far.
Okay, good. So we were talking about reference ranges and reference values. If the reference ranges do not pertain to pediatric patients, let your clinicians know that because a lot of them are seeing pediatric patients. They want to know what the reference values are going to be for that group of individuals. So please make sure that you put that into your catalog. CPT codes. So, we're kind of progressing through to the billing aspect of things. They really are useful, depending on where patient billing is going to occur. So if it's going to occur at the physician's office, or if it's going to occur through the hospital system, wherever it's going to happen, that CPT code is useful. One other thing that I will mention about a must-have, and this is kind of going back to the performance of the test itself. If you have another test that would be performed based on the initial test results, so a reflex test, you would want to include that in your catalog as well, because that way the physician knows there's going to be additional testing performed if needed.
And I think that that just goes along the line of compliance as well, right? So that you notify them that there's going to be a test, or if there's a panel, you list all of the tests that are performed under that panel, right?
Correct.
What are your feelings, Karen, about nicknames or aliases?
They're good to have in there because there are a lot of tests out there that do have nicknames. You can, especially in the realm of genetics testing, you hear abbreviations quite a bit for the longer, like MCAD or MSUD, maple syrup urine disease type of thing. You need to have those in there kind of as keywords. So if somebody is searching on MSUD, it'll bring that test up without having to type in maple syrup urine disease.
Sure. So you're just actually making it easier for someone to find the tests, and certainly a whole lot easier than paging through 10 inches worth of binder information to try and find it, right?
Definitely.
Yeah. So when you think about putting this information online, a lot of people will say, yeah, when we talk to our IT people, we just have to get in line. So when we start to think about maybe creating a strong laboratory website and just trying to take a number with limited IT resources, a lot of groups feel that it could just be a project that gets put on a list and then stalls out. How do we help our listening audience know that this doesn't have to be building a rocket ship? How can it be done easily? What are some small steps they can take?
So small steps, that's how we started our electronic presence with MCL. We started using HyperCard, which was an Excel managed system and a database of information. We provided an Excel spreadsheet to our clients to utilize. You can do that. You can use Excel. You can use Word. It could be something just that simple that can get you started. And if your IT happens to have a little bit of time, it could be that they could provide that information and extract it from your LIS system without utilizing very much time. Put it in that Excel spreadsheet. Personally, I would put it and transfer it to a PDF format. That way nobody can accidentally change any of the information, kind of locks it down a little bit more. The problem with doing that, though, is that the information is static. It's really only accurate on the day it was published. So it does require that constant upkeep to make sure that the information is accurate. The positive thing about that is if you have an existing website for your institution or your laboratory within the institution, you can add your test menu as a link on that, and it would provide that information to your ordering providers in an electronic way. Now, if there's somebody in the lab who's interested in building a simple website to contain test catalog information, of course, they would need to have time too, and that's becoming more and more problematic in the laboratories. But there are a lot of free website builders available, including WordPress, Squarespace, that type of thing. I'm not advocating any of those, but just wanted to bring that to anybody's attention. You do want a system that's easily managed and one that could potentially take information from like a CSV file that you could extract from your LIS to create a dynamic web page from there. And the positive aspects of the web page is now your information is searchable. Those static PDFs, you can search in there. You can do a control F to find information, but it's not as dynamic, if you will, as a web page. The other option would be to check with your reference lab to see if they have a catalog option available. They may be able to help you get a web-based catalog started for your outreach program.
Well, and that's something that the folks in your department actually do every day with our clients, and we have hundreds of them out there. So they're a beautiful, beautiful product. And, it's interesting when you started talking about the things that you can put into a test catalog. I would consider the Mayo Clinic Labs test catalog to be the gold standard. It's everything, right? When I was a customer,
Yes.
I would get called in the middle of the night to do lab testing, and I would be waiting for my cross match to incubate, and I'd actually be reading the test catalog and learning at the same time. It was a great way to pass the time. So obviously ours has a lot of information, but we've seen everything from very basic with our clients to actually quite robust. Are there any kind of favorite things that you see people including in their online test catalogs?
Oh, I have seen people include a lot of different things. We have one client that has the right swab for the right job. So they have an actual um, PDF that provides them with pictures and shows them which swab goes with which test ID. We have another client that adds pictures of the tube types themselves with embedded in their catalogs. So there's a lot of different things you can do.
And it's all with the intent of making it easier for the customer to work with you, right? So are
100%.
there any other things that you think could go into a test catalog that might make it stronger and more useful?
Stronger and more useful. What I would say, especially with an outreach program, patient specimen collection instructions for a variety of tests are good to put in your catalog because then the viewer can pull those up, print them off, and hand them to the patient along with whatever jug they're collecting, whether it be a urine sample or a stool sample. Um, the other thing that is good is directions to your draw sites, not just the locations themselves, but actual directions. I know people have Google Maps, Apple Maps, all those out there now, but it is nice to have the directions to the draw sites out there for those that don't have the map capabilities, as well as their hours of operation. The last thing you want to do is think you're going to get your blood drawn and then realize they just closed. So have your hours of operation out there. Some labs like to provide their certifications in their catalog as well, whether they be CAP, CLIA, AABB. There's a variety of certifications out there, and they may be required to do so based on the state regulations. So that's something that you would need to look into as well.
So it sounds to me like anything goes, as long as
Anything
it's
goes.
related to the business, and the sky might be the limit, right? So
Definitely.
Karen, I just have one last question for you, and this is kind of how I close every one of these podcast conversations is, do you have any favorite tip or hint, any two or three things that you would like to say related to the audience about what they should be doing to promote their own laboratory through a test catalog?
Sure. Um, there's a couple different things. Number one, when you're setting up your test catalog, make sure you know what type of information you would like to convey. Decide on which fields you're going to use, whether it be specimen collection information, specimen requirements, collection information. Name your field and have that consistent throughout all of the tests so it's not confusing to your viewer. You can even develop a template for others to follow because it might not just be one or two people working on your catalog. It might be one person from each section of the lab, and you want to make sure that everything is consistent. The other thing is listen to your providers. They have great insight into what information is needed in order for them to order the correct test. You want the right test for the right patient at the right time. The person who's going to know what additional information is needed in your catalog is the person who's using it. So speak to your end users. The other thing that I will say, it's my own little tip for when I'm looking at test catalog information, when I'm reviewing it, is I look for 3 C's. Is the information clear? Is it concise? And is it consistent? Guess you could add a fourth one. Is it correct?
Or cogent, meaning understandable and relevant, right? So we just
Exactly.
expanded it to 5 C's. Karen, this is fantastic. Thank you so much for being our guest today on this podcast, and thanks for sharing your thoughts on how to make a lab test catalog part of any outreach program. I learned a lot. 5 C's, 3 C's up to 5, and I hope our audience did too. And for our audience, do you want to know more about laboratory outreach success? You have an opportunity to hear from the MCL outreach team and many other outreach experts at our upcoming outreach conference. Leveraging the Laboratory Vision to Action will be held in Nashville, Tennessee on September 16th and 17th, 2025. Registration is now open. Go to www.mayocliniclabs.com/education for more information. And thank you for listening to Leveraging the Laboratory. This podcast is from Mayo Clinic Laboratories. And if you've enjoyed it, please subscribe. And until next time, we encourage you to continue to promote your community-based hospital laboratory. The needs of the patient come first.